Excuse me. According to the Mayo Clinic, over half of all healthy people have Staphylococcus aureus living in their nasal passages, in their throat, in their hair, and in their skin. That sneeze right there could have spread hundreds, if not thousands of germs into the air and onto the surfaces that I just touched. Frequent and proper hand washing techniques by patients, family, and healthcare providers is one of the best ways to prevent the spreading of germs and the transmitting of diseases in the healthcare system. We, at some point in our lives, or family members, or someone that we know will require healthcare attention and be in a healthcare setting. Information on proper hand washing techniques and hand hygiene is useful for us to understand infection and to help protect ourselves against transmittable diseases. I myself work in the healthcare field and have for a couple years now. I've had to go through extensive training in hand hygiene, and I've had to been properly trained on how to do this because in order to protect myself and my patients from transmitting diseases between patients, from transmitting diseases like the common cold that I may have to my patients. I'm here today to inform you and educate you about the different types of diseases that are commonly transmitted in the healthcare system from improper hand hygiene, and to teach you when to recognize that healthcare workers should follow indications to wash their hands and techniques to hand hygiene and why it's so important. Okay, let's begin by looking a little more in depth at the microbes in the healthcare system that cause infection. There are many, many different types of microbes. Some of them are very common, like Staphylococcus and Enterococcus. Many of them actually can have developed resistance, which with a multi-drug resistant microbe, a microbe can cause a disease that normally was treated by an antibiotic and now has become resistant and can no longer, or treatments that were previously used to kill this microbe no longer work. Some examples of these are vancomycin resistant Enterococcus, extended spectrum beta lactamase, and methicillin resistant Staphylococcus aureus. Also known as MRSA, M-I-S-A. It is the most common type of healthcare transmitted disease among patients. It causes a red, swollen, irritating infection in skin that can even develop pus and drainage. According to Valley Care Health Systems, it's actually one of the most transmitted diseases, and it can even colonize on the skin within a month of exposure. There are also microbes in the digestive system, that are very helpful and beneficial to our bodies. According to WebMD, there's over 1,000 different species, and not all of them are harmful, but there is some that cause many devastating diseases. The most common is Clostridium difficile, or C. diff, which actually releases toxins in our intestines, and it attacks the linings of our intestines and actually can cause inflammation and a condition called C. diff colitis. It results in mild to severe diarrhea, abdominal cramping, abdominal bloating, tenderness, and it's very, very painful. It's actually one of the most commonly transmitted drugs among healthcare professionals from patient to patient. Next, we're going to explore indications for hand hygiene among healthcare professionals and the proper procedures that everyone should follow. Really, keeping your hands clean is the best way to prevent the spread of diseases and illnesses. All healthcare workers are required to follow these hand hygiene protocols to reduce microorganism transmission between patients and themselves. It's important to know these things because when you need to protect yourself as a patient or as a family member from healthcare situations and different bugs. So, some indications on when to perform proper hand hygiene. Healthcare workers should perform hand hygiene when their hands are visibly dirty. That means that they're soiled. They should use soap and water to completely clean their hands. When hands are not visibly dirty, they should use an alcohol-based hand sanitizer. Healthcare workers should do this before patient contact, upon entering a patient room, before touching a patient like bodily fluid exposure, and then after touching a patient and upon leaving a patient's room. Certain microbes require that you actually use soap and water instead of alcohol-based hand sanitizers. Now, alcohol-based hand sanitizers have been proven more effective in killing microbes, but there's those sticky ones like C. diff that actually you need to use soap and water for, and those are specific, and healthcare workers know the rules, and they make that information available to their patients and the patient family members. Now we're going to talk about some proper techniques for killing microbes. According to 3M, when using alcohol-based hand sanitizers, you should apply it directly to the palm of your hand, rub all the hands together, completely covering all the surfaces of the hands until it's dry. When using soap and water, it's important to wet the hands completely with water first, apply soap to the middle of the palm, rub them together, covering all surfaces of the hands for 15 seconds, and then rinsing completely with water. And then finally, drying with a disposable paper towel and using that paper towel to turn off the water faucet. Lastly, there's some other aspects of hand hygiene that are really important in limiting the spread of microbial organisms. No artificial nails should be worn. They actually can cause germs to get caught under the nails, or actually they're porous and can allow microbes to live in them. It's important that healthcare professionals keep their fingernails to 1/4 of an inch and trimmed and cleaned at all times. One of the other things that's very important is that when healthcare workers wear gloves, gloves are porous also, and sometimes microbes can get through them. So it's important that when healthcare providers remove their gloves, that they follow proper hand hygiene. And like with C. diff, after removal of gloves, they're required to wash their hands with soap and water. Now you should be familiar with the common microbes in the healthcare system and how to protect yourself and your family members from getting infections from a healthcare setting. By learning proper hand hygiene, you become your immune system's best defense. Frequent and proper hand washing techniques by patients, family members, medical professionals is the #1 best way to prevent the spread of diseases and germs in the healthcare system. Does this always truly get done? Not really. According to the CDC, 1 in 20 patients still obtains an infection from receiving healthcare treatment in a United States hospital. So even though employers are required to do this and are educated on proper hand hygiene, it doesn't always get done. As you go through the day, think about how many germs your hands accumulate, and imagine how many healthcare professionals accumulate. So what if they weren't following proper hand hygiene? They're spreading their germs all over the place. So it's important that you know proper hand hygiene, and it's also important that you ask your healthcare providers if they've been practicing proper hand hygiene. They're not going to get offended. They're there to help you, the patient, or help you, the family members, get your sick family member well again. So they're more than happy to wash their hands in front of you just to show you guys that they're practicing proper hand hygiene. Although we can't see them, there's germs on our hands, and they're always going to be there.